I believe health and disease is a scale. For a simple analogy, if we get good nutrients in, toxicity's low, our body's healthy. But if we don't get the good nutrients in and toxicity, stress, cortisol levels build up, that scale tips. And then we become into a disease state and our body is continuously fighting to rebalance the scale. That is how I look at all of breast implant illness, but my personal health as well. This segment, we will talk about the different modalities, my personal training and experience, and how this protocol helping people get well came about. Approximately 2007, 2008, I had some issues with my hands. I have psoriatic arthritis, and unfortunately, it was involving my hands and fingers, to the point where my knuckles were 2 to 3 times normal size. I couldn't bend my fingers or hold the surgical instruments the way I was trained in my residency. So I sought the consultation of an orthopedic hand surgeon friend of mine and told me to do exactly what I thought I should do, and that was to put me on prescription strength anti-inflammatory medications. Those medications worked great for about 6 months. However, I didn't change anything else in my life, and I was just treating the symptoms. The inflammation started to recur, and as any smart doctor would do, I double dosed on the medication. Unfortunately, it didn't help my hands, and it gave me gastritis. My hands continued to get worse. I then went back to see my friend, the hand surgeon, and he started to inject steroids into my knuckles and did that 3 times over a year and a half. It was the same with the oral medication. Things worked great for about 6 months and started to decline. Another injection, but it only worked well for 3 months. A third injection, but it only worked well for 3 weeks. At that point, I was concerned that within a year to year and a half, I would lose my surgical career. I just happened to stumble into a friend who told me about a plant that grows on the earth, it's been here for 4,000 years, and when she told me it had 36 anti-inflammatories and 46 antioxidants, as well as all the other vitamins, minerals, amino acids, and nutrients that my body needed, I said, I'll give it a try. That was September in 2008. Within 4 weeks, my hands felt better. Within 4 months, I was off all medications and my joints were back to normal. I couldn't believe it. I had to study more. I had to figure out what this plant was. A little teaser, it's Moringa oleifera. We'll talk about that in a little bit. Yet, what I realized was I was not taught nutrition in medical school. I did an online course to get my nutritional counselor certification so I could institute that and understand that better. The company that made this Moringa brought out an essential oil line, and in my naivety, I thought, what is this voodoo? How can you put something on the bottom of your foot and it helps your digestion? How can you smell something and it makes your headache go away? I prejudged it. However, as I did my research, I learned about essential oils. I ended up with 3 certifications in essential oils, one of which took me over 2 years to obtain. What I truly believe is essential oils are God's medicine that He put in plants here on the earth so we could heal ourselves with minimal side effects. That is why I employ essential oils as well. My journey continues. I ended up getting a health optimization coaching certificate. From there, I was introduced to somebody that talked more about energy healing, about Reiki and the power of the mind over the body. What we will do in this process to help you with your breast implant illness is to employ all these modalities to help partner with you to heal your body. If the FDA, the AMA comes in and says, Dr. Lee, those aren't medically approved modalities, I can say, yes, I know. And that's why I want to use these as these other certifications and other understanding on how to combine holistic, naturopathic remedies with our allopathic understanding. So it's a great way to merge the two to help rebuild and rebalance your body. That scale that we discussed, what I'm trying to do is get the nutrients in get the toxicities out, and let's bring that scale back so you're healthy and feeling strong. I previously mentioned the genetic testing for the methylation detoxification pathway. This is a very simple test that is a cheek swab that tests for both sets of genes that we inherit, one from our mother, one from our father. Looking at this in the methylation detoxification pathway, we can get a good idea of how your body detoxifies. Now, this is not a test for breast implant illness. There's not one that exists to date. Hopefully we will in the future. However, there seems to be a very high correlation of women with breast implant illness who have chosen to do this detoxification test and becoming highly positive in the MTHFR gene. MTHFR stands for methylene tetrahydrofolate reductase. That's why we call it MTHFR. It's too hard to remember the whole name. The MTHFR is the first major gene in this detoxification pathway and is one of the most studied genes in the human genome. We know people that have issues with this have a higher incidence of diabetes or metabolic issues like high blood pressure. Oftentimes, women who have issues with the MTHFR have a hard time conceiving or carrying to term. However, there are some dietary vitamins and manipulations that we can do that can help to overcome this. This seems to be the key element that may relate to breast implant illness. Again, I don't have proof of this. I don't have great scientific evidence other than the fact that there appears to be a high correlation of women with a positive MTHFR and breast implant illness. Since we don't have a specific lab test, blood test, X-ray, CT scan to follow the healing process of breast implant illness and the explantation, how do we know if the patient's getting better? I have instituted an inflammatory score sheet that I'm actually borrowed from a friend of mine who's a plastic surgeon in Atlanta. This score sheet is subjective, but it looks at different physical aspects and systems of the body, how much it impacts the person in their daily life. And we total this score. And what we find is anybody with a score greater than 30 is considered highly inflamed. Now, a lot of the breast implant illness come in and their preoperative scores are 90, 100. I actually just saw a woman this morning. Her score was 144. We test this before surgery, 6 weeks afterwards, 6 months, and a year. And it is so fun, so rewarding to watch those numbers plummet. But we can also see it on the patients when they come in. They have a glow to their skin, they have a sparkle in their eye, their hair has a different sheen to them, they're standing up. They have changed, even a week to 6 weeks afterwards. Healing is quite variable amongst different patients, and a lot of that depends on how long the implants have been in and how sick you are to begin. So it does take time in some people, others get rapid results, but in my experience of several hundred explantations, every single patient has gotten dramatically better. Some of my colleagues will say that their response is a placebo effect. Well, the placebo effect can happen. It happens in 30 to 35% of all procedures, all medications, or anything that we do. The placebo effect is where we think something's going to improve or something's going to happen. It does. Let me tell you, that's the power of the mind. When I talk to my colleagues, whether it's placebo effect or not, and we see these inflammatory scores improve and the patient's better, their life is better, what does it matter? Because they are better.